This video is about magnesium. Normal lab values are between 1.3 and 2.1 milliequivalents per liter. More than 50% is found in bone. Conservation and excretion by kidneys. It is important for the intracellular metabolism. It operates the sodium-potassium pump. It relaxes muscle contractions by blocking and decreasing acetylcholine release, including the diaphragm muscles that open airways. Transmits nerve impulses, regulates cardiac rhythm, aids in conversion of ATP to ADP for energy release, fights tooth decay by binding calcium to tooth enamel, and plays a role in secretion and action of insulin by controlling blood glucose. For hypermagnesemia, the causes include decreased renal excretion, such as renal failure, increased magnesium intake, magnesium-containing antacids or laxatives, including MOM, Maalox, Riopan, Mylanta, Gaviscon, Rolaids, etc., magnesium-based enemas, and TPN. Some manifestations include neuromuscular problems, so those are the most common, such as decreased deep tendon reflexes and depressed neuromuscular activity. There's CNS depression, such as somnolence, weakness and lethargy, respiratory depression, and coma. For cardiovascular, there's hypotension, bradycardia, bradyarrhythmias, flushing and warm sensation, possible cardiac arrest, and ECG changes. Treatments are not listed, so I'll have to go back and research that. Then there's hypomagnesemia, so this is not enough magnesium. Causes include chronic alcoholism, that is the most common cause. So chronic alcoholism, not enough magnesium. Decreased magnesium intake, decreased absorption due to IBS, GI cancer, small bowel resection, because there's less surface area to absorb, chronic pancreatitis, and then there's medications such as garamycin. Some manifestations, they usually occur after serum drops below 1 milliequivalent. So there is, for musculoskeletal, there's twitching, tremors, and hyperactive reflexes. There's laryngeal stridor, which can be life-threatening. ECG changes. CNS, there's mood changes, apathy, depression, confusion, hallucinations, and tetany if severe. For GI, there's nausea, vomiting, diarrhea, and anorexia. Labs for magnesium, if it's less than 1.5 milliequivalents, you need to really monitor that. It's concurrent decreases in calcium, potassium, and PO. Some treatments include replacement therapy, IV infusions of magnesium sulfate, IM magnesium sulfate, oral magnesium, and dietary changes. You want to monitor labs, you want to monitor neuromuscular manifestations, you want to monitor the GI, monitor cardiovascular changes, and lastly, monitor if they're taking digoxin, as increased susceptibility to digoxin toxicity.